from Transcarent's perspective, I want to walk through the experience and from a couple different perspectives. Let's start with the employer. What's the employer's experience going to be in working with Transcarent?
So the employer, first and foremost, this is truly a partnership. So we are aligned with the employer. We will never be in a situation where Transcarent will or can make money when the employer doesn't. And today, payers can make money and the employer is left holding the bag. So we start with full alignment, and that means we don't charge up front. We share risk. We're fully at risk. This isn't, we'll put 10% at risk. We're fully at risk. And we're at risk for three things: providing a high quality experience to, if you're the employer, to your employees and their dependents. First and foremost, high quality experience. Second, providing measurable quality outcomes. We have to improve the health of the population, and we need to be able to demonstrate that we're doing that. And last but not least, we have to do that at the same or lower cost. And interestingly, it's not all about cost for them. They want quality care. Remember, if you're the CEO of a large self-insured employer, your own family is going through your health system. You want quality care. You want a good experience. You don't want your employees distracted by their healthcare. You want them to do their job. So we have to deliver on those three promises. And the way we do that is we make sure there's alignment. So we're always looking at it from the standpoint of how do we improve the experience? How do we deliver measurable results? Let me give you one or two examples. So today, if you're getting infusion at the hospital, we would ask you a simple question. Would you prefer to have that done in the safety and at the convenience of your own house? And 90+% of the people say, yes, of course I would. And then half of them follow up with, but I could never afford it. It turns out that it is 30% less on average to send a nurse to your own home to administer that treatment than it is to have you get it done at the hospital. Think about that. You don't have to travel there. That's the single biggest reason people don't get healthcare. They have travel issues. You don't risk COVID or any other infection being at the hospital. And what could be more convenient, safer, more comfortable than being at your own house? And yet 30% less. Well, here's the problem. Who's going to tell you that? The hospital's not. The insurer's not. They're all making more money when you spend more money. So we step in and say, listen, we have this new service. Let me give you another example with medications. If you go today to a CVS and you need a statin and it's a generic, if you walk in and you have no plan, they'll say, okay, it's $4 or $6 or whatever the cost is. If you have a plan and you say, yes, I'm insured, they'll say, what's your copay? My copay is $20. Okay, it's $20. So because you're a member of this club, you now just got to pay $16 more. That's the most ridiculous thing in the world. Who's benefiting from that? The PBM is benefiting. The payer is benefiting, but you aren't. Your employer isn't. So we're going to stop that. We're going to say, that's ridiculous. We're not going to allow these kinds of things to happen. And that's where the alignment comes in. So that's why employers love it, because the real simple question I want them to ask is, why would we not do this?